Welcome. Feel free to participate. We want it to be participatory. I'll not just be talking or Alessandro. We want to talk to each other, to one another. We communicate because actually UNGASS is about communication. The key word in UNGASS is communication.
This project exists because in 2001, the governments of the world, they come together at the United Nations and they said, you know, HIV and AIDS is a huge epidemic, it's a huge problem. We need to do something stronger to address it. So they signed a declaration of commitment that is called UNGASS-AIDS, where they put goals to be achieved for 2003, 2005, and 2010. So in 2007, we started this process to monitor those goals, but not the whole goals. We thought that could be much more important if you could take a look in specific issues within those goals. And because women are disproportionately affected by HIV and AIDS, we thought that it would be very important if we could focus on the women's problems and to see how could we help our governments and the international community and the local community to implement better policies to address HIV and AIDS among women. So Kenya, every 2 years, needs to prepare a country report and to inform United Nations about the situation. In 2007, we started preparing civil society, support the civil society in 16 countries to help them to report, to create data, evidence-based data, to send to their governments and ask to the governments to incorporate that perspective in their national report. Of course, not all governments liked the idea. Many of them rejected the idea in the first place because they said, how could civil society have data to give to us? So we have data. Civil society do not produce valid data. Of course, situation was different from country to countries, but in general, we would like to have a space where civil society could come together from different movements, so groups that were working with children, groups that were working with women, groups that were working with human rights, groups that were working with harm reduction, sex workers, transgenders, all people that were working with HIV and AIDS. We'd like to have this space where they could meet, talk, share their perspectives, share their information, and trying to create a kind of common advocacy agenda, because we are full of documents, we are full of declarations, we have, you know, even our laws, sometimes they are good laws, but they are not implemented because we believe that what is lacking is our capacity to come together as a group of civil society and to monitor together. I think that my organization can do something in this area, and I think that my organization could do something in the other area, and then we can combine efforts to make sure that it's not going to be only another document. How could we strengthen each other to make sure that you have something stronger in the end of the day, which is something that could really touch upon the women's life and can make a difference, to women and girls. Also, what Jesus is doing, we provide technical support for the research, or in many countries they decided to hire consultants to produce the report. But what we are really concerned is not reporting itself. What we are really concerned about is we need to have this advocacy plan to implement some key actions that could impact in the way government is drafting their, policy for women and girls.
Health is a basic human right. And it is one of the basics rights that should be provided by every government to its citizens. Now, when the government goes down or goes out there in high-level forums and signs declarations with the intention of looking good, and then once they come back to the country, for some reason or for one reason or the other, they are unable or they are not very willing or not very keen to implement this same declaration, my feeling is that that is a direct, it borders very, very closely to violation of the human rights of its same citizens who it's bound to protect. Therefore, as civil society, the evolving from just being docile community trainers and caregivers and and record keeping at community level, we definitely then are bound. Now that we have this kind of information, I'm so glad that I'm able to attend this kind of a forum. We are bound to be able to keep the governments on their toes. So I think the minimum that we can expect is the government to involve us or to involve the civil society in making very concrete, detailed implementation plans on, because my needs in Kariobangi and Korogosho might be a bit different, or they might slightly differ with someone who's living, say, in Sekawangware, despite the fact that both of them are, we are living under the same, environment, but slightly. So if the government is able to engage the civil society in that manner, then definitely that will involve a lot of discussions. The civil society will need to be consulted, and it will have to be involved in policy formulation and deliberations. Basically, that is what is called politics.